We begin with the stalemate on healthcare funding. Amid a crisis in Canada's hospitals, the feds and provinces are trying to reach an agreement on more money. But talks this week collapsed. Manitoba Premier Heather Stefanson is the chair of the Council of the Federation, which represents all of the provinces. She joins me from Winnipeg. Premier Stefanson, I understand that you and your colleagues are quite frustrated with the federal government right now, but I had to ask you about the events this week where this letter, this press release that the premiers wrote days before the meetings began in British Columbia, released hours before the meetings ended in British Columbia, calling the meetings a failure, and yet you're calling the federal government the unwilling partner here. I mean, how are Canadians supposed to reconcile all of this?
Well, I think what it is David, is that we have put a proposal out there for the federal government. It's now been well over 2 years, and we've yet to even sit down at the table and have that discussion. And I think what Canadians want to see from different levels of government is that they're working together towards coming to a solution to this challenge. We know that healthcare is one of the most important issues to Canadians out there, and they want to see us working together. And we're hoping to be able to sit down at the table and have those discussions.
Well, we were in Victoria this summer when Jean-Yves Duclos sort of made a meeting of health ministers a precondition for the first minister's meeting you're looking for. And this was the meeting. It was happening in British Columbia. And you say you want to work together, but how is it working together when you've got a draft news release ready to go, calling the talks a failure even before they begin?
Well, I think, what the challenges are, David, is that we're not sitting down as premiers across the country, sitting down in a First Minister's meeting. This is what we have said all the way along, that we need to be having discussions at the First Minister's table. And that's what we've been calling for. And we've got a proposal out there. Again, if the Prime Minister has a proposal, we just want to sit down and have those discussions. That's the appropriate table for it to take place at.
But the federal government has some preconditions on that meeting, right? They want to see some agreements on data collection and information sharing and some conditions put in place before you get to that meeting. And that's what was supposed to happen in British Columbia. And Minister Duclos came out of it saying that the premiers wouldn't let the health ministers do their work. Is he right to say that? Because it sounds like you don't want any conversations except at the premiers and prime minister's level.
No, it's not true at all. And what I would say is that, we've always said all the way along that the most appropriate place to have those discussions is at a First Minister's meeting. This is discussions about, these are budgetary discussions, and it's about the future of healthcare in our country. We know how important this is, particularly coming out of a pandemic. And we're just hoping that we can sit down at the appropriate table and have those discussions, which is at a First Minister's meeting.
So how does what happened in Vancouver help you get that meeting? Issuing this statement before the health minister's talks were over, calling them a failure. I mean, how does that help build the trust to get to the point where you can sit down with the Prime Minister and have this conversation?
Well, what we need to see from them is some sort of a proposal. We haven't seen anything yet from them when it comes to this. And so, we have put our proposal out there as premiers across the country. And what's unfortunate is that we really haven't seen anything from the federal government about this whatsoever. We have said time and time again that the appropriate place to have this discussion is at a First Minister's meeting. We are ready to have that meeting anytime now, that they are available to do that. And I know as premiers across the country, we stand united on this front to ensure that we do what's in the best interest of Canadians, and that's get them more health care sooner and closer to home.
Right. So when you say you haven't seen a proposal from the federal government, I assume you're talking exclusively on long-term funding arrangements, because there have been proposals from Minister Duclos on data collection and sharing and sort of benchmarks and measurements on transparency in the system. Is that what you're talking about solely on the money side?
We have not seen any proposal as premiers from the federal government whatsoever, and not on the Canada Health Transfer, and that's what we've been asking for some time. I think it's time now to put everything aside for us to sit down and to do what's right for Canadians to get them the health care that they need.
So you said a second ago that premiers are united on this. We've heard that before from premiers in 2016 and 2017, the last time there were big talks about health care increases. And we saw Jane Philpott and Bill Morneau go around and cut deals one by one with province after province until they had everybody on board with their conditional money and not the no strings attached across the board increase premiers were looking for. Are you concerned you might see a repeat of that happening now, that provinces that really need cash are enticed to sign deals with the federal government and your unity evaporates?
Well, what I do know that certainly as premiers across the country that we are united on this front to ensure that we get that increase in the Canada Health transfer to our provinces. And again, we're looking for the federal government to come to the table on that front. I mean, I would hope that we could stop playing games here and just do the right thing. And that is to sit down at a table, have an open dialogue about the future of healthcare in our country. I think Canadians are looking for that, and they deserve it.
What do you say to Canadians, though, who look at this, Premier, and say really kind of all sides are playing games? I mean, you've got some provinces that can't fully account for some of the COVID money they got. There's unspent healthcare money in their budgets. I know you're looking at a review of business and personal income taxes, which would be cutting off revenue at a time when you're saying you don't have enough money to pay for these core services. There seems to be a lot of politicking happening on this while emergency rooms are overcrowded, pediatric medicine is in short supply, and sort of a country and a healthcare workforce kind of doesn't care if the health ministers sort it out, the finance ministers, or the premiers sort it out. So what do you say to people who are looking at all of this and are frustrated by what's happening?
Well, more and more of what's happening is that healthcare is becoming a larger portion of our provincial budgets. And we know certainly in Manitoba, and the average across the country is it's about 40% of our budget. We spend 78% of it. The federal governments contribute 22%. That used to be a 50-50 split.
It's higher than 22% when we look
to,
at the tax points. Sorry to interrupt you, Premier. I don't like to do that.
Well, I have to say it's certainly not 50-50. I will tell you that much.
But it could be 30 to 30.
There's a reason why we need to move forward.
It may be closer to the 35% you're looking for than the 22% you say it is. I mean, there's been some analysis that put it at 29, others that put it as high as 33. The 22% is not an accurate reflection of the contribution to the healthcare system.
What I will say to that, David, is that it's becoming increasingly every year more and more a percentage of our provincial budgets, healthcare. And so that encroaches in other areas like education,
right,
social services, other areas that are needed. And so that's why we're asking the federal government to get back to, I mean, we're not even saying get back to the 50-50 split where this started, but they need to come to the table so we can at least have these discussions. That's all we're asking for.
Yeah, and I certainly don't want you to think I'm understating the challenge provincial governments are facing on this. That and debt servicing are eating up more and more of the budgets. But I guess a final question, Premier, before we let you go is, the Prime Minister and the federal government has said they want meaningful conversations to happen at the health minister's table. You say it can only happen at the first minister's table. Where do we go now? Because the health minister's talks didn't work, and there are no first minister's talks scheduled as far as I can tell. So what happens next to find a solution on this?
Well, I think it's pretty clear. I think Canadians want to see this. This is one of the most important issues that we face across our country. The Prime Minister knows that, and he knows that he should be the one sitting down at that table along with the premiers across the country. It's incumbent upon us as the leadership of this country to sit down and have a discussion about one of the most important issues that we face in our country.
Okay, Premier Stefanson, thank you so much for your time.
Thanks very much, David.
Okay, so that was a provincial take on those unsuccessful healthcare talks this week. We're going to get the federal perspective now. Jean-Yves Duclos is the federal Minister of Health, and he joins us from Quebec City. So, Minister, you've heard, I assume, all or most of what Premier Stefanson had to say. What's your reaction to her comments?
Well, hello, David, and hello to everyone. Well, my first reaction is that I am obviously upset, but more importantly, nurses, physicians, and many others, patients and experts are quite upset with the fact that health ministers were working really well until really recently on two plans, one to support health workers and therefore to support patients' access to family doctors, better mental care, better mental health care, greater and faster reduction in backlogs in surgeries and diagnostic. We're working really well and had two strong, solid plans until the premiers asked my colleagues to stop doing their job and not to share those plans, and not to start implementing them. That's very bad, not only for obviously the patient, but also for the workers, because that strong collaboration needs to happen at the health minister's level.
Right.
And we want and need premiers to stop interfering in that work.
Well, I heard you say that in Vancouver the other night, that the premiers have told the health ministers, or basically instructed them not to do the work. What proof do you have to support that claim, sir? Is that your assumption based on the letter that was released, or have you been told by your health colleagues that they've been told not to cut deals with you because it all needs to go to the First Minister's table?
Well, three things happened. First, we all were in agreement about those two plans, and some of my colleagues, health ministers, had worked really, really hard on those plans to support workers and to support patients. But then a few days ago, premiers apparently wrote that letter declaring our conference of just a few days ago to be in advance a failure. And then as we were discussing things around workers and patients, now, the premiers issued a statement saying that the conference would be a failure anyway, regardless of how hard we would be working together. So those are three signs that the premiers really didn't act in good faith and preventing us health ministers do the job we need to do together to achieve results that Canadians need and expect from us.
Well, how do you do that now? How do you work together and achieve results if, as you say, there's no point in the health ministers meeting because the premiers won't let them do the work? But they say there's no point in talking at the health minister's level because this needs to be resolved at the First Minister's level, and they want to talk to your boss, the Prime Minister. How do all levels of government move ahead to get some cash and money into a health system that's screaming for help?
Well, premiers get it wrong. You want to speak about means before speaking about ends. We need to speak about ends and then speaking about the means necessary to achieve these ends. The good news, and that's important to share because people want to see and feel that there is good news. The good news is that we all agree at the health minister's level, but equally importantly, nurses, physicians, personal service workers, all of the experts that are following the situation, we all agree on the same priorities and the same results we need to achieve together.
Right, but we've got the situation, Minister, where hospitals and emergency rooms are overloaded, pediatric rooms are overloaded, you've got massive burnout issues in all levels of the health sector coming out of the pandemic and the stress and strain of COVID, which still is with us going into this flu season. And, whoever is to blame, the national and provincial political leaders are bickering over process and timelines and who's going to meet and not working on the central issue. So, I mean, what does it take to move past that? Somebody has to flinch a little bit, don't they, and compromise on how you sit down and who actually talks to who?
Well, let me point to a central part of your question, which is about the dollars. Now, the federal government has been providing and keep providing and will be providing even more dollars and resources to the provinces and territories. Just the CHT, that CHT has increased by almost 6% in March last year, will increase by an additional 10% in March of 2023, in addition to all of the ongoing increases, the $72 billion to continue the fight against COVID-19, the investments in long-term care, in mental health care, in home care, all of that continues and builds up over time. Now, but dollars won't solve the problem, because if that was the case, if dollars, as premiers pretend, would save a system, they would have what it takes to save and to solve the problem.
Right.
Because most of those provinces now are running surpluses, and the vast majority will be running even larger surpluses very soon. So if the dollars were the solution would be there. But we know it takes more than dollars. We know it takes results. How do we invest in workers, in nurses, in personal service workers? How do we make those people work better together with greater access to family health teams, greater access to mental health care, reductions in backlogs? So how do we work together to achieve those results, which what Canadians want to see?
Right, but how do we work together to achieve those results when the politicians can't work together to set up a meeting where both sides can sit down with good faith and actually work towards these goals? I mean, it appears to be a central breakdown in trust, and I can understand your frustration that they've got the press release written days before you even got to Vancouver for the meetings with the health ministers. But, here we are. I mean, do you get to the point now where you just start trying to do the one-on-one deals like we've seen in the past, and you find premiers who may be more open to some of the conditions and the reforms you're talking about and move away from the joint meetings and start trying to pick province off after province?
Well, a good thing in that debate is that, yes, they may be bickering at the premier's level, and you've seen this and you just heard that recently. But at my level, and more importantly, when I speak and when we speak to representatives and leaders, and nurses, the physicians, the personal service workers, the lab technicians, the pharmacists, everyone is working together really well, because we focus on the results that matter to Canadians. So I'm positive and optimistic, because that cannot be stopped by premiers asking just for dollars sent to finance minister. David, sending dollars to finance ministers is not going to help my colleagues, health ministers, and certainly not going to help look after patients and workers in Canada.
Right, but if, as you say, the health ministers are restrained from having meaningful talks with you by the premiers, how do you move forward? I mean, based on what we saw in Vancouver, I imagine there are no new health ministers' talks on the schedule. And as far as I know, there hasn't been a first ministers meeting planned. So what happens now?
Well, I'm continuing my discussion and my work with health ministers. I had one just this morning. I'm going to be in touch with individual health ministers over the next days and weeks, because, as I said, we work well together. We are, we are focusing on the same priorities. The problem is that publicly they can't speak about these things, because premiers ask them to speak about dollars only. But they know, as I do, that it's not dollars that will solve the problem. No, yes, there will be more dollars, but we need to speak about what we want to do with those dollars. We need to speak about the ends that matter to Canadians. So at my level, I'll continue to work with my individual colleagues from different provinces and territories. At my level, I'll continue to do the work that is expected of us.
Right, but just a final question. The Premier seemed determined not to let anything go ahead, or don't believe anything should go ahead unless it's at a meeting with them and the Prime Minister. So should they hold their breath on that? Are you going to give them the First Minister's meeting? Do you know if your boss will sit down with the Premiers and try to move this ahead?
I think it will be counterproductive. I think premiers can't stop our work, our collaborative work at the health minister's level, and they can't be deaf or blind to what nurses are saying. Not the Canadian Medical Association, the Canadian Nurses Union and Association, the personal service workers. Everyone agrees. So we need to move on, and we need to stop the bickering at the premier's level and let the health ministers, the nurses, the physicians, all of the others do the important work that we need to do together to look after patients in Canada. Now, patients need us, and we have to be there for them.
Okay. Health Minister Jean-Yves Duclos, thank you so much for your time.
Thank you.